CAPTA is the Child Abuse Prevention Treatment Act. And CAPTA, the first CAPTA legislation about 4 or 5 years ago, states that all children who were recognized to have been affected, and that's the word that's used, affected, by prenatal exposure to illicit drugs must be reported to child welfare, and child welfare must evaluate the child and then link that child into early intervention services. Now, the overall idea is a good one, trying to ensure that children who have been affected by prenatal exposure do have access to early intervention services. The problem is no one really defined what affected means. And so as states implemented their CAPTA requirements, we were called on multiple times to help states work through this idea of, well, what does affected mean? And the other problem with the first legislation is that it specifically excluded alcohol. The new legislation, which has just come into place now here in 2011, it does expand the definition to include all children who have been affected by alcohol exposure, and this specifically talks about fetal alcohol spectrum disorders. But where we fall short here is that most physicians and other clinicians don't really know how to recognize children who may have been affected by prenatal exposure to alcohol. So my second policy recommendation is, in the context of CAPTA, I think we need extensive training across systems of how to recognize children at risk, and then how to link them from the child perspective, to the child welfare system, and then ultimately to early intervention.